Infertility is defined as the inability to conceive after regular unprotected intercourse for more than 12 months, 2 to 3 times a week. This time frame does not apply after the woman is more than 35 years of age. This occurs in 1 in 6 couples. What does normal conception require? For conception to occur, the following are required. For the woman, adequate oocytes or eggs in ovaries. Occurrence of ovulation and oocyte is released by the ovary and enters the fallopian tube. Oocyte travels through the fallopian tube towards the uterus. The fallopian tube is where the sperm meets the oocyte and gets fertilized. The fertilized egg then successfully implants in the lining of the uterus. For the man, his sperm needs to have an adequate quantity in concentration or count, the ability to swim in a forward direction or motility, and have a normal shape, also known as morphology. Here are some causes of fertility problems. Male factor is one of the most common causes for around 30 to 50% of couples who have difficulties conceiving. Other causes include ovulatory dysfunction when ovulation does not take place every month, tubal blockage, unexplained fertility, which can occur in 10 to 15% of couples after investigations, and other issues such as endometriosis. A detailed medical history will be taken from the couple trying to conceive, and a physical examination will be performed. For the female partner, this will include an internal examination. The following basic investigations will be performed. For women, preconception screening is done to ensure her body is ready for pregnancy. This includes blood tests for hemoglobin and thalassemia screening, antibodies to rubella, antibodies to varicella, and infection screening. We screen for the following infections as they are sexually transmitted and can be vertically transmitted from mother to child. If any of them are positive, they have an impact on your partner. These infections have to be treated before we attempt any fertility treatments. Cervical cancer screening through a pap smear or HPV test is performed during a speculum examination. This is to ensure there is no precancer or abnormal changes of the cervix prior to conception. Next, fertility-specific tests are done to look for causes of infertility. These take the form of blood tests for basic hormones like follicle-stimulating hormone, luteinizing hormone, estradiol, and testosterone. These tests are taken during day 2 to 5 of the period. The levels of these hormones provide the baseline information on how the brain signals are passed to the ovaries to determine if there are any abnormal levels of hormones which suggest problems with ovulation, hormone imbalances, or menopause. Test for luteal phase progesterone. This test is performed on day 21 if a woman has regular 28-day cycle. If positive, it is usually indicative of ovulation with the formation of the corpus luteum, which produces progesterone. Anti-Mullerian hormone test. This tests for ovarian reserve or the amount of oocytes or eggs supply you have in the ovaries. Prolactin hormone test. Prolactin is a hormone in your body that, if elevated, can cause irregular periods and infertility. If found to be positive, further investigations have to be performed and treatment given prior to conceiving. Thyroid function test. Thyroid hormone is a hormone that is produced to ensure normal cell metabolism and balances the activities of the growth and function of cells and tissues. Abnormal thyroid hormone levels can cause menstrual irregularities and infertility. Any women with an abnormal thyroid function test will need to be treated before commencing any fertility treatment. Normal thyroid function is required for fertility and normal development of the fetus during pregnancy. Other tests that may be done include chlamydia and gonorrhea swab tests. These are sexually transmitted infections and can be asymptomatic or present with vaginal discharge. If found to be positive, you and your partner need to be treated with antibiotics. Furthermore, it can cause damage to the fallopian tubes, resulting in fallopian tube blockages, thus causing infertility as the egg gets fertilized in the fallopian tube. Imaging scans will also be performed, including the following: pelvic ultrasound, which is usually performed during day 2 to day 5 of the period. This is performed to exclude fibroids, ovarian cysts, or adnexal masses. Hysterosalpingogram, performed between day 7 to 10 of your menstrual cycle. This is an X-ray performed while a dye is instilled into the cervix. It is done in the radiology department. A speculum is inserted into the vagina so that the cervix can be visualized. A dye is then instilled through the cervix via a fine tube. If the dye flows out successfully through the far ends of the fallopian tubes, it demonstrates that the fallopian tube is open and free from blockage. For men, the following basic investigations will be performed. First, a preconception screening with blood tests for infection screening. Semen analysis is also conducted. The husband's semen sample is collected and analyzed in the laboratory. Ideally, you should abstain from ejaculation for 3 to 6 days prior to collection. Certain important parameters are measured, such as the sperm concentration or sperm count, sperm motility, and morphology. If these 3 parameters are normal, this would be considered as a normal semen analysis. Management of fertility treatments. In general, couples trying to conceive should refrain from smoking and drinking alcohol. They should also try to maintain a healthy weight and BMI between 20 to 25. The fertility treatment recommended will depend on the cause of infertility. If the cause of infertility is due to severe azoospermia, when there is no sperm seen on the semen analysis, the male partner may have to undergo further testing by a urologist to assess for the possibility of surgical retrieval of sperm prior to fertility treatment. For mild to moderate male factor infertility, intrauterine insemination may be suggested. For moderate to severe male factor infertility, in vitro fertilization or intracytoplasmic sperm injection may be suggested. If the cause of infertility is due to ovulatory disorders, ovulation induction may be commenced for the woman. This may be in the form of oral tablets taken on day 2 to day 5 of your period. In cases where oral medications cannot result in ovulation, gonadotropin injections may be required. Serial ultrasound scans would need to be performed to monitor the growth of your follicle and to ascertain ovulation. In vitro fertilization is normally recommended if ovulation induction has been successful but failed in achieving a pregnancy. If the cause of infertility is due to tubal blockage, this refers to ovulation occurring in the fallopian tube naturally, but with blockage of both fallopian tubes. The sperm is unable to reach the egg naturally in the fallopian tube. If the fallopian tubes are blocked, in vitro fertilization will be recommended. Thank you for watching this video. This video is presented by Yongloo Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.